Assalamualaikum everyone. I hope you are healthy and doing well. I am Dr. Ayesha Siddika Shammi, lecturer of Physiology at Bashundhara Ad-din Medical College and Hospital. In today's lesson, we will learn about blood grouping and blood transfusion. At the end of the class, we will be able to answer some questions. Those are: what is blood grouping, how blood grouping is done, and what will happen if we transfuse A positive blood in B positive blood group person, and what will happen to their children if a female of a negative blood group marries a male of positive blood group. At the end of the class, we will be able to answer these questions. To know or to understand blood grouping and blood transfusion properly, at first we have to familiar with these three terms. So let me tell you these three terms. One is agglutinogen, agglutinin, and agglutination. What is agglutinogen? Agglutinogen are the antigen which are glycoprotein or mucopolysaccharide. Those are present on the surface of the RBC. These antigen can also be present in some other sites like lungs, kidney, liver, semen, saliva, and in response to this agglutinogen, agglutinin or antibody will be formed. What are these agglutinin? Agglutinins are the gamma globulin which are present in the plasma. Most of them are immunoglobulin M and immunoglobulin G. And what is agglutination? Antigen-antibody reaction, that is agglutinogen and agglutinin reaction will cause agglutination. That means there will be clumping of RBC. So as example, if the agglutinogen is A, its corresponding agglutinin will be anti-A. What do you think? Are they friends? No, they are not friends, they are enemy. So if there is agglutinogen A and anti-A antibody, there will be agglutination. That means clumping of RBC will occur and the RBC will be destroyed. So what is blood grouping or what is blood group? Blood group is immunologically distinct and genetically determined group specific substance which are present on the surface of RBC and corresponding, and there will be agglutinin in the plasma. Now let's come to the blood group. There are 30 occurring antigen or other antigen on the RBC membrane, but we classify it. There are major blood grouping system: ABO blood grouping system, RH blood grouping system, and MN blood grouping system. And other minor antigens, what are the other minor blood group? They are Kell, Duffy, Diego, Kidd, Lewis. But in today's class, we will read or we will learn about ABO blood grouping system and RH blood grouping system. How we classify or how we type the ABO blood group system? We do it presence of A or B antigen on the surface of RBC. So let's say if the blood group is A, its agglutinogen, what will be its agglutinogen? Its agglutinogen will be A agglutinogen. And what will be agglutinin? Okay, for understanding the agglutinogen and agglutinin of ABO blood grouping system, let me tell you one law, that is Landsteiner law. This law has two parts. First part is, if an agglutinogen is present on the surface of RBC, so corresponding agglutinin will be absent from the plasma. So what we know, for agglutinogen A, its corresponding agglutinin will be anti-A. So according to the law, this agglutinin will be absent from the plasma of that person. So there will be anti-B. And the person having blood group B, agglutinogen will be B and agglutinin will be NTA. And second part of the law is, if an agglutinogen is absent in the plasma, corresponding agglutinin must be present in the, if an agglutinogen is absent in the plasma, the corresponding agglutinin must be present in the plasma. So what happened here? In O blood group, there is no antigen, zero antigen. So what will be the agglutinin? It will NT-A and NT-B. Okay, this is according to the second part. And what about AB blood group? AB, there will be anti-agglutinogen A and agglutinogen B, but in the plasma there is no agglutinin. What are the prevalence of this blood group? Blood group A is 41%, blood group B is 9%, blood group O is 47%, and blood group AB is 3%. Okay. So now let me tell you one thing. And what will you do during transfusion? If I want to transfuse blood, I will give A group blood to A blood group person. Why? What will happen if I give B blood group to A blood group person? Here, give attention. In the blood group A, on the surface of RBC, there is agglutinogen A and agglutinin B. So if I transfuse B blood group to A blood group person, what antigen carry B blood group person? It carry agglutinogen B and it has agglutinin A. And if I give this to A positive person, A blood group person, so this anti-A of this agglutinogen B of the donor will act or react with anti-B of the recipient. Okay, so what will happen? Agglutination will occur. There is an interesting thing. Blood group O is considered as universal donor and blood group AB is considered as universal recipient. Why blood group O is called universal donor? Because in blood group O, agglutinogen A and B both are absent. So what do you think? I have blood group O, so am I harmless person? Do you think I am harmless person? No, I am not harmless, because if we transfuse this O blood to other blood group, there is absence of agglutinogen A and B, but there are other antigen on the surface of RBC. Earlier I have mentioned there is other blood group typing like KL, Duffy, KIT. Those antigen will react. So it is theoretically possible, but in my life I have never seen such case where O blood group is given to other blood group person. So now we know the ABO blood grouping system. So can we transfuse blood now? What about this portion? We know when we say blood group, we say A positive or A negative. What is this portion? Positive and negative. I have already mentioned about A and B. How A and B is, we group A and B. But what about this positive and negative? This positive and negative portion is RH blood grouping system or RH blood group. How we do RH blood grouping? This RH name came from a monkey, that is rhesus monkey. First RH factor was determined in the blood of rhesus monkey. That is why it is called RH. In RH blood grouping system, there are 6 antigens, that is capital C, D, E and smaller C, D and E. We classify it or we group it as RH positive and RH negative on the basis of presence or absence of these capital D or antigen D. If a person has antigen D on the surface of RBC or RBC membrane, then the person is RH positive. And if the person has no antigen on the surface of RBC, then the person is RH negative. But there is one interesting thing, that this RH typing, this RH system does not obey the second part of Landsteiner law. What was the second part of the Landsteiner law? The second part of the Landsteiner law was, if an agglutinogen is absent from the RBC membrane, the corresponding agglutinin must be present. But here, in case of RH system, there is no corresponding agglutinin in the plasma. Those who are positive, they also don't have this antibody. Those who are negative, they also don't have this antibody. Okay. So how this antibody will be formed? Anti-RH antibody will be formed or NTD antibody will form when we will transfuse RH positive blood in RH negative person, or when the RH negative mother will carry RH positive fetus in the womb. Okay. So, prior giving blood transfusion or doing blood transfusion, what will we do? What test will we do? We will do blood grouping. That means we should know the blood group of donor and blood group of recipient, and cross matching. What is cross matching? Cross matching means that in the lab we will match donor RBC with recipient plasma and we will observe that agglutination occur or not. Okay, and other screening test. What are the screening tests? Why we do screening test? Is we will perform this screening test for donor blood. What are the screening tests? By doing screening test, we can identify some virus and bacteria or parasite. That is, if the donor has hepatitis B and C, AIDS, malaria, cholera and syphilis. To identify this virus or these parasites from the donor, we perform this screening test. Okay. Now let's come to the topic blood transfusion. Now we have done this blood group of donor, blood grouping of donor and recipient. We have done cross matching and we have done screening test. And all that those tests are done, then we can transfuse A positive blood to A positive blood group person. Okay, but doing this, there may be reaction. Transfusion reaction. There may be transfusion reaction in case of matched blood group. Like A positive, if I give A positive blood to A positive blood group person, there may be reaction. The reaction may be matched, reaction may be immediate and maybe delay. What are the immediate reaction? Immediate reaction are those reactions which immediately occur after transfusion. Those are maybe restlessness, shivering, chills, fever, allergic reaction, anaphylactic reaction, or circulatory overload. If we transfuse much blood, that's what we need. Then what are the delayed reaction? The delayed reaction will be transmission of those disease. I have previously mentioned those disease. Then delayed hemolytic transfusion reaction, and also formation of multiple microembolism in the circulation. And what happened if I transfuse A negative blood in A positive blood person? The immediate reaction will be, what will be the immediate reaction? The immediate reaction will be restlessness, severe chest pain, limb pain, back pain, or dyspnea, hypotension, then dyspnea, hypotension, shock. And what are the delayed reaction? This delayed reaction is mediated by this Rh incompatibility or by the Rh antibody. Those will be jaundice, anemia, then renal shutdown, or hematuria or hemoglobinuria. Those will be delayed reaction. So mismatched blood transfusion will cause Rh incompatibility. That means if we transfuse positive blood, that is as example A positive blood into A negative blood group person, this will cause Rh incompatibility. And Rh incompatibility can also be caused by if a woman of Rh negative blood group marries an Rh positive blood male, then the baby, if the baby is Rh positive, then Rh incompatibility can occur. So let me explain what will happen if a female of Rh negative blood marries a male of Rh positive blood. So during the first pregnancy, there will be no problem, because if the baby is Rh positive, so during the pregnancy there is no problem in the baby. But during the delivery, when the Rh negative blood enters into the maternal circulation, then in the mother's body there will be formation of anti-Rh antibody. And during the second pregnancy, if the baby is Rh positive, then what will happen? This anti-D antibody will enter into the fetal circulation and it will attack the fetal antigen D on the RBC membrane. That will initiate the agglutination. So RBC will clamp together, and this clumping of RBC is called agglutination, and this will phagocyte by what? Macrophage. And this phagocyte RBC will be destroyed and hemoglobin will be released in the circulation. This hemoglobin is releasing in the circulation, it will convert into bilirubin, so there will be anemia and jaundice in the fetus. When there is deficiency of hemoglobin, the fetal hemopoietic tissue like liver, spleen and other tissue will try to form more and more RBC in the circulation. So what will happen? There will be immature, so liver and spleen will be enlarged. There will be hepatomegaly and splenomegaly. And when there is tends to formation of more and more RBC rapidly, so blastic cell will come into the circulation. We know blast cells are immature cells. These immature cells will come into the circulation, and this is the thing we call erythroblastosis fetalis. So in erythroblastic baby, what happened? There is anemia, there is jaundice, there is hepatomegaly, splenomegaly. And as we know, the fetal liver is immature. This immature fetal liver is unable to conjugate this excess bilirubin. This excess bilirubin will what will happen? This excess bilirubin will cross the blood-brain barrier and it will precipitate in the basal ganglia and motor area of the brain, and the baby will be born as mentally retarded. This is called kernicterus. This bilirubin, more bilirubin when deposited in the brain, it is called kernicterus. So in the baby, what will happen? In the baby of RH incompatibility, the baby will have, the erythroblastic baby will have kernicterus. So what is there any treatment or is there any prevention? What will we do? I have seen in my life there are my friends who are RH negative and they have married RH positive male and they are happily married. So and their baby is healthy. So what happens here? So here happened, what is the prevention? We can prevent it. After first time delivery, we will give anti-D injection to the mother, and in the fetus, if the fetus is already born, erythroblastic fetus is born, we will replace its baby's blood, that is RH positive blood, will be removed from the body and it is replaced by RH negative blood. How will you replace? We will replace this 400 ml of blood over the period of 1.5 hours over weeks. We can do it up to 6 weeks. This is the treatment for erythroblastic baby. So at the end of class, I have already mentioned, then you can answer, you will get answer of this question. So there is no problem marrying an RH negative person, RH negative female, because there is prevention and also there is treatment. But this is mandatory to know the blood group. I hope you all know your blood group, and for this is for today's class. I hope you have enjoyed the class. So no more today. I am saying goodbye here. Assalamu alaikum.